And one of the reasons we do that is because I value your time being here, and I thank you all for being here. One of the major things that we try to encourage here is understanding that your care is a discipline in your life that starts from youth. Okay, it's habits that we start, and habits that will help throughout your lives, and that's why this workshop is so important for many people to understand why to start and where to start from. But ultimately, you know, when we are talking to you about chiropractic care, who usually comes for? What do people usually come to chiropractor for?
Adjustment.
Adjustments. But what first brings you in the door?
Pain.
Usually pain, okay, in most cases. And I always talk about the first chiropractic adjustment, which started 1895. D.D. Palmer adjusted a janitor that worked in his building, Harvey Lillard, and the guy regained his hearing. Okay, so when chiropractic was founded, it never really was founded on the sense of pain, although that's why most people come. And chiropractic, actually, the name came. There was a gentleman, there was a friend of D.D. Palmer's, and they were trying to come up with a name. And they came up with the name chiropractic because practic means practice of. And it's very easy, you know, that's easy to understand. But chiro actually means hand. So it's practice by hands. And that's where the word came up from. And the reason, and there's a lot of different ways to adjust. We use the activator, we use the drop tables, we use some mechanisms and things that are going on from there. But ultimately, the hands are the biggest tools. That's like when we're feeling your spine, it's like feeling Braille for a blind person. And ultimately, your pains are what brought you here, but that's not our major concerns. Our major concern is you being your healthiest. You being able to express the best health that you have. You making sure that regardless of whatever conditions are going on, whether it be anything from the common cold to cancer, that your body is able to adapt and fight and do the things that it's supposed to do. There's a time and place for everything, okay? But ultimately, if you give yourself the best opportunity to heal, it's going to have a better opportunity to heal if something comes up. And when should you take care of your structure? When should you take care of your health in general?
All the time.
All the time. It's not something that, what do most people do though? They wait till they're in pain, or they wait till they have, like I have several people that I know that have cancer, and there's a woman that I always speak about that's up at another chiropractic office, and she went in, young, beautiful woman, 30-something years old, stage 4 cancer, okay, and she had no pain, and she had no discomforts, no nothing. However, she's going through not the standard medical protocol here, but she's doing something different, and her tumors are shrinking. She is living the lifestyle that we should all be living, is that healthy, clean lifestyle. But what usually happens, people wait till it's too late. They wait till they have the cancer, or they wait till they have the tooth decay, or they wait till they have the problem, and that's when they start saying, oh, maybe I should change the way I'm eating. Maybe I should change the way I'm doing things. Because we don't think about that, because we abuse ourselves. So these workshops are geared for you to understand that you have some information that will encourage you to stay healthy. Take one piece of nugget, share people, and all the guests, thank you for being here. It's really, really, really great to see people here. And understand that health never ends, okay? It's a lifetime commitment. It's just, it's the way you choose to handle it. So having said that, I'm going to start on the workshop, and it's about children and chiropractic. So why do you think we should take care of children? Why do you think it would be important for a child to get adjusted? As Frank said, you know, people come for adjustments. Why do you think a child should be getting adjusted? What's a good reason? Does anybody have any ideas?
The sooner the better.
The sooner the better. Right? So the sooner the better. And what do you mean by that? Does that mean like it helps to prevent things, or help to, you know, right? Okay, and so that's one of the reasons. So ultimately, the sooner the better. Okay, both my children. Some of you saw them here tonight. My 15-year-old is now 5'7", and I'm like, okay, where's the shotgun? You know, and the other one is about to be 13, but she's tiny. And you know, they've been getting adjusted since literally 5 minutes after they were born. Okay, and people are like, what do you do for adjusting a child? It's really not that hard to adjust a child, because when you adjust a child that small, especially, think about taking your pinky, finding a ripe tomato, and just putting an indent in it with your pinky. That's about the pressure you would put on a child's spine when they're that young. Okay, and why is it important? Well, I'm going to show you a picture. There's no young children in here, so I'm going to show you a picture of a child being born, and it's naturally. Can you guys see that picture up there?
No, the projector's not on.
Oh, that would help. Thanks, John. I'm waiting for it to come on, and while it's coming on, I'm going to read. So we talk about, why we should emphasize children. Well, like you said, sooner the better. We can correct the subluxations earlier, or those misalignments in the spine, either at birth or before. Making sure we're focusing on them for a better future, which allows the child to have less disease or imbalance, and emphasizing children relates to us as we get older, because we do relate to things that our body builds up on. So having said that, these are the emphasis that we should have. The question we always have is, we look at a natural, quote unquote, a natural childbirth. Can you guys see that picture? Has anybody ever seen or been at a birth? You have, okay. Have you ever seen how they pull on the kid? Has anybody ever they yank, okay, they yank. And this is why the pink elephant is here, okay? And the spine, okay? Because the baby is supposed to sit, 80% of the time, the baby sits on this side over here, in the pelvis, okay? This is where they usually sit. And this picture, you may not be able to see it, but I'm going to turn the light off. That's why I walked over here. If you look at that picture, look how stretched that kid's neck is. Look at that. You ever see a baby, okay, when they come out, do they have a neck that's that long? No. Their necks are really short, okay? They're stretching it a lot, okay? A lot. And I'm going to talk about what kind of trauma that can cause. And we call that traumatic birth syndrome. And, most medically that's to them, oh, that's a normal birth, okay? So what most babies, 80% of the time, are here. Sometimes about 15-20%, like in my wife's case, they're over here. If the baby is facing this way, it's called back labor. Okay, so the baby is facing down like this and not if the baby is facing up, it's back labor, because the baby pushes up against. It's actually what happens is the baby turns into it, and the baby will come out through here. Okay, so this is where the baby comes out of. She's making faces. Okay, she's making faces. So what do? Hold on to this spine for me. Hold the spine. Okay, hold it. Okay, they put the actually come up here because we're recording this. Okay, and I would that's okay. You can turn this way. You don't have to have your face on the camera. Stay there. Okay. So if you look at this, what they're doing is, in most cases, the woman is lying how? On her back. On her back, not seated with gravity. Okay. So what ends up happening is you're going to hold on to that. So the baby comes through, right? So the first thing they're doing is they're pulling. Now hold it. Okay, and that's basically what they're doing. Okay, they're shaking. Okay, and then they try to get one shoulder out, and they stick their hand in there. Okay, and the shoulder comes out, and then they do this. They turn the head 180 degrees. Okay, now look at what I have to do to get this baby out. And this is not, this is about the size of a regular baby, and you're holding that tight, and I'm holding this. Okay, and then they pull, and then all of a sudden it goes plop. Okay, do you think that can cause trauma to a kid's neck? Absolutely. Thank you very, very much, Wendy. Okay, so let me ask you a question. This baby has just come out and has been yanked on and pulled on. Do you think it would be important to check the spine to make sure there's no problems in it and make sure the nervous system is functioning? Why? This is why. According to Abraham Tobin, MD of Harvard Medical School, life for the newborn depends on the preservation and healthy functioning of the brainstem and spinal cord at the level of the upper neck. So that's right in this upper area right here. Okay, so that's the very top portion of that. And actually, if you've ever seen a live-born baby, they're about this size. They're not much bigger than this, if they are. They're, 7, 8 pounds, 6 pounds. They're tiny. They're really small. Okay, and it's like, oh my God, they're so fragile. But think about that stretch on the neck. Okay, so if this is not lined up, it can affect the brainstem, which has respiratory centers and fever centers, and 85 to 90% of the stuff that's integrated in our body crosses over in that plane. So the body is learning from a bad position. Now, people think if they have a C-section that it's okay, that it's not stressful. No, they're still sucking the kid out with a vacuum, or they're still using forceps. Right? You're laughing, but it's true. Okay, it's not any less stressful for the baby. And think about what it does to the mother. And it's not like they say, okay, I'm going to cut you open, move your organs, take the baby out, and then put everything back in. They don't do that. It's a small slit, and they pull it open. So it's important that the child is checked immediately after birth. 50,000 newborn deaths occur each year in the U.S. Approximately 10,000 of these are due to unexplained respiratory failure known as sudden infant death syndrome. Professor Tobin cites respiratory depression or failure as a cardinal sign of spinal cord or spinal cord brainstem injury that occurs during birth, but with frequently escapes diagnosis. Why does it escape diagnosis? Because there's no major signs or symptoms. There's no, quote, how do you ask a baby if they're in pain? You can't. Okay, there's no real signs or symptoms unless the baby's crying and something is off. Okay, so and that can be for a lot of things. So that's where it starts. It starts with the child at that age. Dr. Gottfried Gutmann, a German medical researcher, discovered that over 80% of the infancy examined after birth was suffering from cervical spine neck injuries, causing many types of health problems. And this is from what they call normal, natural births. He found this. Okay. J.M. Duncan, a medical researcher, measured the amount of force required to severely injure a baby's neck during delivery. So, think about this. The average doctor puts 50 to 70 pounds of force on the neck when they're pulling, okay, when the baby is being born. Okay, 50 to 70 pounds. If they add forceps, the big salad tongs, okay? It's funny, but that's what they look like, They grab the forceps, they use the forceps, it adds anywhere from 40 to 50 pounds. It can go up to about 120 pounds of additional force, okay? And at over 150 pounds of force, you actually decerebrate the spine, which means you disconnect the spinal cord from the brainstem, or the brain, excuse me. So you can actually, that's major injury, that's cerebral palsy. Okay, the average stretch on a child's neck when they're born is 1.5 inches. 2 inches is where it starts to decerebrate or cut off. Okay, and the average doctor, he found that 90 pounds of J.M. Duncan found that 90 pounds of force could cause stillbirth, while less could sprain the upper neck, causing health problems and so forth. That's when you start, like you said, okay? The earlier the better, and that's why it's so important to get children checked, And we look at the following things that may happen from upper neck injury. Most people don't think about this stuff. So an upper neck injury, we talk about the nervous system and just some of the things that are controls, but up in the top, that brainstem area has the cranial nerves. It has, like I said, respiratory function, which is a huge one. It also helps to control blood pressures, and everything is regulatory. It's all up here. So if you damage it, it's going to cause a problem. So some of the things that are sometimes associated, according to this is a woman that I know from the Chiropractic Pediatric Organization, Dr. Erin Elser, and she did a lot of research on this. But some of the things that may occur: colic, recurring middle ear infection, asthma, allergies, chronic colds, irritability, hyperactivity, sleeping difficulty, headaches, neck and back pain, seizures, tics, growing pains, torticollis, scoliosis, keep going. I mean, the cause, if you don't get to the cause first, because these things may still arise, but you're not giving the kid the honest chance to heal when it comes up. So this is an important place to start and to look at everything. So why is that important? Well, vitamin, and if you want to, I have 3 books like this of pediatric research. I was sitting there and I've read all this stuff, you know, and I'm looking at it and I'm like, case reports and you know, and I always hear, oh, where's the proof? Where's the evidence? Oh, it's only, everybody knows what anecdotal means. Anecdotal means just like 1 or 2 people. They do studies. But ultimately, if you get enough anecdotal evidence, if you get enough people with the anecdotal evidence, it becomes, it starts to become true. And there is so much research and so much anecdotal evidence and so much stuff going on that, you know, that it's absolutely amazing. That shows that children that have problems that are not adjusted from an earlier age, they have more problems. Both my kids have been adjusted since they were born, like I said. They have never taken any medication. No, excuse me, I'm sorry. I always forget this because I had weakness in my heart when it happened. No, I'm just kidding. My older daughter had a fever of 104 for 3 days. And I'm of the ilk that you let the body do what it's supposed to do, okay? The brain will not go into seizure until about 106, 107. And it won't cause permanent damage until 108. And this is right out of the New England Journal of Medicine. Most people don't realize that a kid having a fever of 104, 105 is pretty normal, okay? Because they run at higher temperatures. But I went to the doctor, we got some antibiotics, and the day I got the antibiotics, her fever starts to come down, but I was like, let me give her the antibiotics. That's the only time she ever took antibiotics. She's 15. She's never had any medications in her life. Okay, my 13-year-old, nothing. We do herbals periodically, so they take no medication. So the thing is, if you're taking medications and there's things going on, there is another way. It's just a little different. Okay, it's not what the norm is for society. And the thing is, you just have to work harder, and it's really hard to work on this stuff. So these are the big things. These are the big things that we look at. So having said that, there is a study done by a gentleman named Vitamin. He's TK Vitamin MD out of University of Helsinki in 1988. So how many years ago was that? 27? 26, 27, right? Found that joint degeneration began on a cellular level 5 to 7 days post-injury, no matter the age. Okay? So he found that after 2-3 weeks of joint fixation, just 2 or 3 weeks of joint fixation, meaning a subluxation that's stuck and not moving. Okay, 2 or 3 weeks. The scar tissue starts to form within 5 to 7 days. If it's there for 2 or 3 weeks, 18 months was required for optimal healing, but this healing was always incomplete. So if you're not taking care of it before and you're waiting, you may not get complete change. So you have to understand that. That's why when people come in, they're like, oh, why do you keep going back? Because I've had a lot of years of abuse on my spine. I healed compression fracture in my neck, you know, arthritic changes, you know, disc degeneration from lifting heavy weights. That's why I keep continuing to get it checked, because I know that I did damage to my spine and nobody ever addressed it. And that's why we here have a passion for addressing children. And if you see them, they come running in. And we have one little girl, the minute she sees me, she starts screaming and yelling and like, oh, don't touch me. And today she was great. And then you have the other ones just run into my arms. You know, I mean, they're all different. You know, but it's important to understand that if the joints stay fixed, they're going to start forming scar tissue right away. And if you wait long enough, it's going to take a real long time to retrain it. And you may not get full change on it. So having said that, we look at some of the issues that can come up, and you know, there are deformities that form in the spine. So if you, like I was saying, I have a healed compression fracture in my neck. If you look at the bones of the spine, they all look different. This is a cervical vertebra, okay, and you can see this is the one in the neck. You see the holes in here on the side? That's where your vertebral artery goes. It actually goes through the cervical vertebra. Spinal cord goes right through here, but you can see how small it is. Okay, and this is about the weight of an actual bone. An actual bone is not that heavy. Okay, it's very, very light. So this is what it looks like. Then we look at a thoracic vertebra, which is in the middle. I don't know if you guys can see that well, but look at the size difference. See that? That's a huge difference. Okay, and they get bigger as they go down. Okay, and what ends up happening is here. You can see the back of it is much different. Okay, the back becomes, because here down in the mid-back you have more muscle that's attached to it. You have all the thoracic muscles and all the core muscles here. And then as you get lower and lower, this is still a thoracic vertebra. And you can see how much bigger it is, and you see how it starts to point down. And then we look at a lumbar vertebra, and you can see it's the back starts to flatten out like this, but it's bigger. So it looks, you can see the differences in the way our bodies are shaped. And any one of these, if you look at any one of these, if you looked at, say, for example, I'll give you an example of the compression fracture in my neck. If this was the normal bone size from the side, mine looks like this. It's flat. Okay? You're not going to heal that. But the thing is, nobody ever addressed it. And I used to play, and it came from an injury that I had playing football, but I didn't have the proper curvature in my neck. That curvature in your neck helps to improve the impact on your body by 7 times. It strengthens the spine by 7 times. So if you get an impact, it's like this spring. Has anybody here ever worked on a car? I know you have. But have you ever seen those big springs that they have in the cars, or even a shock absorber? But the thing is, you hit it, this spring, and it rebounds. Okay, and the bigger, the thicker the spring, the more rebound you're going to get, right? So guess what? The thicker your discs are, and and the more flexibility you have in the spine, guess what? You're going to have more rebound. So the average child, by the age of 2, has fallen 2,500 times. Stand up, sit down. Stand up, sit down. Stand up, sit down. Stand up, sit down. Stand up, trying to walk, boom, falling. And the average child by the age of 2 has fallen at least once from the height of a changing table. 50% of them have fallen at least once from the height of a changing table. So when they say your parent accidentally dropped you on your head, it happens 50% of the time. Yeah. Yo, what are you saying over there? So these are the big things. So you think about that, and by the age of 4, it's about 4,000 times. I mean, it just keeps going and going. So it's important to get them checked, because the thing is, if those bones subluxate, scar tissue starts to form right away, and it starts to heal in that position. And then you can have things like scoliosis and degeneration and the ligamentous forces that aren't working. Okay, so we talked a little bit about the trauma. We talked a little bit about the trauma with the forceps. That's a long lever. I mean, if you want to lift something heavy, what do? You get a really long lever, you push on this side, and it helps you to lift it easier from the other side. Okay? All right? That's what they're doing with the forceps. They're using a long lever and using all this force to try to, it amplifies the amount of force that they're doing. And it's just scary, because people don't ever look at those things and understand where those things are coming from. I can't stress it enough. I've seen it personally, and my niece is autistic, and she was developing fairly quickly until the age of about 1.5 years. And there's other factors. We can look at vaccines, we can look at other things, and that's a whole other discussion. But she started showing forms of autism. She had pervasive PDD and Asperger's, and she graduated high school. She's highly functioning, but you could definitely tell there's something wrong with her. But she didn't start speaking until she had chiropractic care. What happened was my brother's a retired NYPD sergeant, so he doesn't listen to me. He knows everything. My sister-in-law was 18 years an ER nurse, so she really knows everything and ran the ERs basically. She could outdiagnose most medical doctors because of the stuff that she experienced. So, you know, they didn't really listen to me. I was in school, I was learning about stuff. I said, guys, why don't you try it? Because you got nothing to lose. One of the techniques that I do, I'm pediatric certified, and that's this whole book. And I'm pediatric certified in chiropractic. I have to stress that, not in the medical world, but in chiropractic. There's a difference. And I told them, why don't you get her adjusted? Why don't you go? So what happened was they never did. She was about 2 years old, and if anybody's ever experienced an autistic child or an active child, they really don't sleep. They are, you know, they don't rest. You have problems. You know, they have problems. So any advance at all in a child that's autistic in their symptoms, you wanna make sure that that's a positive for them. Okay, but any advance is really a positive. So she was about two years old, and I was just about finished with school, and I had learned craniosacral type therapy or craniosacral work. So my mom one time, I went to my mother's house. My mother lived near my brother in Long Island, and I went and I visited my mother. I was home from school, and I took my niece down in the room that I was staying, and I held on to her. I did some very light adjustments, like I told you. The pressures, the amount of pinky on a tomato dentation, and I just worked some cranial work. That day she took a nap, and she was almost 2. And my brother came over to pick up his daughter because my mom used to help him out. And he goes, where's no, I can't even remember. Caroline. Okay, Lauren is my first niece. Where's Caroline? And my mother goes, she's taking a nap. And my brother turned around and said, what are you talking about? She never naps. The body wanted to go into a healing state. When we rest, our body heals. So she started changing. So over the years, I would periodically adjust her. And then when I moved back to New York and stayed with my parents for about 7 months when I got out of school. And I would adjust her consistently. And my mother would say to me, did you do something? Because I never told my brother. I did it without his knowledge. Did you do something? And I'm like, yeah, Ma, I adjusted. She goes, keep doing it. So every time I came back, she would have me adjust her. And eventually she came to love it. She would say, tickle me, Uncle Sam, Doc, and all this stuff. And when she was about 4, when I graduated and I was there for a consistent basis, she was about 3.5. She was 3.5, and I started adjusting her on a three time a week basis, because my mom would say, you got to get her adjusted because she relaxes everything. And all of a sudden, her teachers started to notice that she wasn't echolalic anymore. Does anybody know what echolalic is? That means just repeating words. There was no cognitive function. You know, there was just like, repeat what I say. All of a sudden, she started putting sentences together. She started speaking with the teachers, and they were like, well, what are you guys doing? My brother came to me and he goes, have you been doing something with Caroline? Because he was like, she's been coming over here a lot, and all of a sudden she's getting, I go, yeah, I've been adjusting. He goes, keep doing it. Because they saw the changes. Okay? And to this day, there's a lot of things that my brother and I don't agree on, and there's still, they don't take her, they wait for me to come there, and I'm like, oh God. But the thing is, it changed this young girl's life. And I saw it happen. Okay? Think about what you do, and think about the things that you're doing, and think about the things that can happen, and you might not even notice the change in the child. But that slight ripple of change may become something large. And it's huge. And think of it this way. I was listening to a story today about a daredevil from the mid-1800s. He tightrope walked across the Niagara Gorge. I can't remember his name now. I think it's Bolden. I had it written down. I was like really excited to share it with you guys. But he said, okay, I'm going to walk across. So he walked across with the tightrope across the gorge. And then he carried like a 30-pound sack. And then he carried a huge 300-pound ingot in a wheelbarrow across. Okay, yeah, it's insane. It was insane. He actually did. I don't know how that heck he did it. And then he goes, okay, do you think? And everybody's like, oh yeah, you can do it, you can do it. And then he asked, do you think I can carry a person across? And he goes up to this high functionary, you know, and he says, well, why don't you get in the wheelbarrow all the way across? And the guy says no. What does that tell you? You can't force someone to do something if they don't want to do it. It's easier to pick up something and move it than it is to get someone to change their mind, or to get someone to think differently outside the box than it is to move a piece of furniture or move something else and carry it across. Because this guy did it 300 pounds, so a person weighs about 150 pounds. But that person's obstinance in their mind did not let them do that. And it really, really struck home for me, because my question to you is, what's your wheelbarrow? Who are you trying to help? Who is it that we are here to help who's not getting into the wheelbarrow and joining you along the way? This is huge. I mean, this is really, really huge, because one of my goals here is to get a chiropractic school up in this area and teach people about health. Okay? Why do you think I do these workshops? Do you think I do it for myself? Yes, I do. I mean, because it keeps me on track. I'll be honest with you. It's totally, there's nothing altruistic about it. It's all self-centered. No. But really, honestly, the only way people are going to change is, what's your wheelbarrow? What is it that you stand for? What is it? Where are you going? Who are you going to help? That's what we're here for. I mean, you guys, there's a lot of guests here tonight, and thank you so much, because I can't do it. This is what this stuff is about. People fight coming to these workshops. They fight wanting to learn. Just be open-minded. It's a half an hour. You're done. You know? And if you have questions, that's it. You looked up at the clock like you were surprised.
I was.
It's a half an hour. A lot of information. I could go on for hours about this stuff. But you know what? If you pulled something small, whether it be the story or whether it be not, you know, whether it be something about learning about the actual structures and things that go on, take it with you. And if you want to make a change, do so. Be the daring one. Put your wheelbarrow out there and go out onto the gorge and have people ask to join you. It's huge. You have to stand for something, you know, and what is it for? That's up to you. Has anybody ever seen Karate Kid? One of my favorite, the old one, not the newer one. Yeah, it's like, he goes, when he wants to start training him, he goes to him, and I can't remember the exact wording, but he goes, ah, maybe so. Yeah, I'm ready. Yeah, I'm kind of ready. And he goes, listen, he sits him down and he goes, either you do or you don't. Maybe so in the middle, like a grape. You get squashed if you're in the middle of the road. Okay? You either do it on one side or do it on the other side, but if you stay in the middle of the road, you're going to get squashed, like a grape. Don't be that person. Talk. Say things to people, because it's really, really important. Thank you very, very much for coming. You guys have a great night. Okay, now I have to look at. I don't have my glasses on. I can't see. How do you stop this thing?